Hi, this is my annotated bibliography presentation. The title of my article is Boundary Making in the Medico-Legal Context, Examining Doctor-Nurse Dynamics in Post-Sexual Assault Forensic Medical Intervention by Leslie McMillan and Deborah White. Here is my citation. It was published in 2019 as a feature in the Sociology of Health and Illness. This slide is an overview of my methods and findings. The study that my article is about took place in a small region in England. The exact location was not stated in the article. The study included a total of 11 participants. This included 7 doctors and 4 nurses. Of this group, all the nurses were females. One of the doctors was females, and the remaining doctors were male. Interviews were then conducted. These interviews took place in a private location and lasted between 1 to 2 hours. These interviews were also recorded so that data could be analyzed. Themes within the interview were then developed by rereading the transcripts of the interviews. These themes were conceptual topics surrounding around expert versus non-expert boundary and competence care within the medical field of post-sexual assault examinations. In the findings, there were repeated gender divisions among those who performed post-sexual assault examinations. Male forensic physicians prevail over females when legal action is involved. This can create professional divide where there is more masculine evidence collection as well as care. But female physicians prevail over male doctors if the examination is by itself and isn't needed for a legal case. Nurses are also represented of having caring duties, while doctors are portrayed as more medically competent within the forensic examination process. This study reiterated traditional gender divisions between nurse and doctor roles. Nurses who participated in the study expressed their ability of being equally as competent as doctor counterparts when performing examinations on rape victims. On the other hand, doctors expressed doubt in the competence and ability of nurses collecting proper forensic evidence. So what is the difference between nurses and doctors performing post-sexual assault examinations? A main thing that this paper talked about were expert witnesses. So there's a view that doctors can only be considered expert witnesses in a court of law, and that nurses aren't able to do that. We can say that that's very different in the United States. In the United States, a lot of sexual examinations are taken by SANE nurses, which stands for Sexual Assault Nurse Examiner. This is where nurses who are specifically trained to perform sexual assault examinations. This has created a reliable and effective way for sexual assault examinations to take place. England doesn't necessarily have a system for who performs these examinations. Typically, doctors are contracted by police forces to perform the examinations. Some forensic nurses are also able to perform these, but is very limited compared to the United States. SANE nurses are specifically trained to document, report, and provide comfort to the patient. This article shows that there's inconsistency in post-sexual assault examinations in England. There's a common belief that nurses are not as capable of performing post-sexual examinations, and this also applies to the legal side of the system. The system largely constructs doctors as being experts within the capacity to provide opinion and interpretation as expert witnesses, and nurses as only professional witnesses or witnesses of the fact. So my thoughts, overall, the sample size was pretty small. It would have been maybe more interesting to hear what other doctors and nurses thought. The findings kind of bothered me. I believe that the system that America has adapted with SANE nurses not only provides the most effective care and comfort, but it's created a reliable and pretty consistent system. I don't agree with the fact that doctors are more competent in being able to perform these examinations. I think it's really important for a specific person to be able to do these and have a specific training. This creates better care for the victim. And so we can see greater issues for the victims of people in England because a lot of them are having male doctors assigned to them. And it's more so about getting evidence and less so about care. Whereas sane nurses here in America focus a lot about care and comforting the individual. Thank you.